So today we're going to talk a little bit about the magic of finding your mid stance or your midfoot. Now, this can sound a little bit silly to someone as a lot of people that come to you with knee pain, they're like, obviously the problem must be at my knee. That's where it hurts. Here's the thing with that though, is that sometimes it has nothing to do with the actual knee joint itself. It's how you're loading through that knee joint. So we've got our leg here, right? And what's interesting is that a lot of times people think it has to stack like this. And that's not true. When these muscles, the quad that's way up here, comes down and attaches down here, or your hamstrings that are back here and come down and attach at the back of the tibia, if they were to sit straight up and down like this, they don't have any good lines of pull to use there. When we are in a good anatomical position, we actually need a little bit of some angles for these things to pull on. And a lot of times, if we don't have the ability to reach and bear weight through the middle of this foot, we can't control and have a good solid place to push down from. Whereas if we're all the way back here or we're way out here trying to push, it doesn't work well. A lot of times my knee pain clients will come to me and they like to hang out back here on the heel, or they like to skip from the heel straight forward onto the forefoot, and you can see how much pressure that would put on the knee. Whereas people that have a good happy knee can weight bear through the middle of this foot a lot better. So finding that mid stance and learning how to operate there can help us work our quads better, help us use our hips to support ourselves a lot better, and can really work a lot of magic. So for a lot of people, finding the midfoot or mid stance can be a little bit tricky, especially if you're somebody that's having some knee pain. But the easiest way to do it is to set up with both feet in front of each other, take a small step forward. Now, some of you might go right into mid stance and put that weight on it. A lot of you, if you have knee pain, are going to do this. You're going to put it here, or you're going to put it here and be way over. More likely, you're going to leave it back here. You're actually going to be standing on this back leg. So if you go to take that stride step forward and stop, I then want you to think about doing this. I want you to take your body forward over that foot, but let your shin move forward. Think of the rest of you as one big solid chunk above your shin bone. And as that rolls forward, you just follow it. You don't shift or bend your hips. You just follow that forward. Now, hopefully at this point, you can feel like you're actually on top of the whole foot. You've got the whole thing with your body weight supported. You're not way in the front like this. You're still not way in the heel. You're over that whole foot. Now notice, my knee is a little bit soft. My shin is a little angled forward, but I am over top. You can almost, or should be able to, draw a line from my ear down through my hip, down into my knee. But when that line keeps going, it should actually hit right around the middle of my foot, not my ankle joint. You are now in mid stance. Now, for those of you that are not used to being here, this is going to feel weird. There's going to be tension in your calf, there's going to be tension in your quad. Sometimes just learning to hang out in this position and be able to lightly tap that back foot means that you are finally standing in a mid stance position. And if you hang out here for 30 to 40 minutes, sorry, 30 to 40 seconds, minutes would be aggressive, 30 to 40 seconds, you may actually start to get a nice quad burn because your quad is engaged and actually supporting you. And it's in such a foreign way that you are not used to it. This is actually one of my favorite ways to start a lot of my knee clients is teaching them how to get back into this position. Because from here, we can hinge, we can squat, we can get back into a lot more motions anatomically, biomechanically, whatever way you want to put it, but is in a good loaded way that doesn't irritate that knee tissue. So give this one a try. Learn how to be in that mid stance. And when you get there and you learn how to actually load into it, play with it. Try some squats from there, try some hinging from there, even maybe try some other movements from there. See how that actually affects your body a little bit. And if you really like it, drop me a note in the comments, or if you want to actually see how you can do more from that position or the progressions from there, drop me another note in the comments and I'd be happy to share more.